In this video, I'm going to teach you a strategy called one versus multiple approach. This is an approach I use when there are multiple symptoms. I'm going to explain about this in a couple of minutes. So let's take this example. So your patient is a 5-year-old boy, Lucas, who has a fever, headache, and vomiting. Don't worry about the other things like Lucas is fully immunized and all the other things. All we need to do now is 5-year-old Lucas has 3 symptoms. So when you apply this strategy is particularly useful when it is more than one symptom that is given in the scenario. So it's easy for us to actually think about fever only or headache only or vomiting only. But sometimes when you have more than one symptom, like 2 or 3 or 4 sometimes, if you add diarrhea to this, that becomes a completely different scenario. So this is how I used to approach that kind of scenarios. The first thing I used to do is I used to actually look at the 3 symptoms separately. For example, fever first, then headache, then vomiting. So I used to look at all these 3 things separately. I look at the differential diagnosis. For example, fever. So I look at fever only first. I will not worry about the headache and vomiting. So all I look at is the fever. So once with fever, I use our first approach. Like I said, always start with the A, B, C, D, E approach first. Okay, so you look at the A, B, C, D, E approach, then you go for red flags and routine approach. Then you will have most of the answers there. Then you apply the same thing to headache. So you do the same thing here where you will apply the A, B, C, D, E approach and you use the red flag and routine approach. Then you are going to vomiting. You do the same thing here. Any number of symptoms, do the same things there. Then once you do a bit of brainstorming, all you do now is put all these 3 together and look at what are the diagnostic triads, what are the possibilities that can happen with these 3 symptoms together or 4 symptoms together. For example, if we look at fever, headache and vomiting in a child who is unwell or of this age group, it could be meningitis, especially if there is a rash in this patient, unless proved otherwise. Okay, so if there is diarrhea, for example, fever, diarrhea, headache and vomiting, it could be gastroenteritis. But still, you have to look at the whole picture and look at each and individual symptom separately. And again, as I'm telling, this course is all about brainstorming. What you do outside the room before you even go into the room and talk to the patient, before you greet the patient, this course is all about the 2 minutes time. How you are going to utilize that 2 minutes time is the most crucial bit in your exam. So the entire course, I'm only focusing on the brainstorming aspects, the strategies I used to use, the strategies that help me pass all my exam stations. So make sure you look at all the 3 separately and you'll put all the 3 together, then ask the same questions like what is the ABCDE here, what are the red flags with these 3 symptoms, and what are the common causes with these 3 symptoms. For example, fever, headache and vomiting. The red flags are things like meningitis, severe infection can present like this, and gastroenteritis, bad gastroenteritis can present like this. Then you go for common causes like gastroenteritis. Again, sometimes there will be a bit of overlapping between the symptoms. Sometimes what is in the red flag will be the same in common causes. Don't worry about it. Again, as I said, this is all brainstorming. You're training your brain, so that you have a list of differentials, and once you go inside the room, all you do now is rule out your differentials by asking those particular questions pertaining to that particular diagnosis. I hope you got this one. And so this is one versus multiple approach, where you use this approach where there are multiple symptoms.